Okay, so now I'm going to show you the difference between the female and the male when we cath a patient. So I come in and do all the same things that I do with the female. I come in, identify my patient, name, date of birth, allergies, put them in a comfortable working position for myself. They do not need to be dorsal recumbent. He can just kind of be leaning back. His legs can be together or they can be slightly spread apart. So I'm going to do the same thing as I'm going to clean him first, just general cleaning. I'm going to clean the glands first. The glands first, new area, shaft, new area, shaft, new area, shaft. All right, and then I'm going to dry. Now, if you have an uncircumcised patient, make sure you pull the foreskin back and make sure you put it back, okay, when you're cleaning and all that. All right, so I'm going to remove my gloves, wash my hands, set up my sterile field. Again, at comfortable working height, but it has to be at least above my waist for sterile field. Same thing, I'm going to make sure I have the right size catheter. It's a 14 French. Make sure I have all the equipment. If I didn't use medium gloves, I'd bring in another set of gloves. All the same things. I'm going to still use the bag. Make sure you have nice privacy. It's easier, obviously, to find the urethra in male. The only thing that's more difficult on the male is sometimes if they're older, they have an enlarged prostate, then it can become more difficult. One thing you want to remember when you're doing the female or the male is you never force it. If you meet a little bit of resistance, you have them take a slight deep breath. You can just do a slight turn and see if it goes in, but never force it. If that is the case, you need to take that out. Most likely the male may need a cath catheter. All right, so we're going to go ahead and do this male right now. So again, when I'm opening up the cath, when you're opening up any kind of sterile kit, it's away from you first, towards you. I'm sorry, the side towards you. Again, it depends on how the tray is set up. Sometimes the sterile gloves are on top, and sometimes the drape at the bottom is on top. This one happens to be the drapes on the bottom, but like I said, I could have put on my sterile gloves first if it was the package the other way, or I can continue to do this way and just move my sterile gloves aside. I'm putting the shiny side or the blue side down. All right, I'm going to pick up my sterile gloves. Remember not to touch anything inside your kit while you're doing that. Put them on the side, and I'm just going to bring my kit over to the side. You can put it on top of the patient's legs, to the side of the patient. You could leave it on the table even if you want. I'm just going to put this right here. All right, ooh, started to fall, and that's okay. Still sterile. I'm going to go ahead and put my sterile gloves on. Remember how you put sterile gloves on. You open up your package away from you, towards you, and then open this from the inside. Don't touch all on the outside of the package. And another thing you want to remember is once you get that package open, just leave that sterile glove package alone. Don't try and move it around and all that. That's when you contaminate everything. So I'm pinching it, lift it up, find my glove, my fingers, my thumb. Go ahead and pull that on. Come over here. I want all my fingers inside of this. I want my thumb out. And I want to put this on. It goes just like this. Oh boy, I didn't get them on very good. That's okay. Sterile to sterile. I'm okay. All right. So now I'm going to take my kit. I'm going to unpack it. I'm going to stay inside my boxes. I'm going to pick up this fenestrated drape. The fenestrated drape only gets picked up with my sterile gloves. I'm going to put the shiny side down, and I'm going to lay that over the glands of his penis. I'm going to open up my kit the same way I did before, sterile swabs. Sometimes you have two syringes. One might be with sterile water and one might be with the lubricant. This one happens to be sterile water. If I had a lubricant package, it depends on your facility. Some facilities you are going to, like your book does, they'll have you actually clean first and then use the lubricant to actually inject into the meatus of the penis. Some facilities you just, when you're trying to lubricate, they have you just lubricate 5 to 7 inches. So know your facility policy. At this one, I'm going to have you just lubricate 5 to 7 inches of the catheter. So open your lubricant. I just have the little packages of lubricant, so I don't have actually a syringe filled with lubricant. It's hard to open. There we go. So open it and squeeze it out onto your tray just the same way I did for the female, except I'm going to make sure to lubricate 5 to 7 inches. Lubricant is your friend. Don't be afraid to lubricate. Make sure you get enough lubricant on there. Just get it all over. Lubricate a full 5 to 7 inches. And I need to know that you know what 5 to 7 inches looks like. Don't lubricate just an inch and say to me, well, I've lubricated 5 to 7 inches. Really get that lubricant on there. So double check, make sure you got everything done that you need to have done. Kind of hold yourself over here, take a look. Everything ready? Everything is ready. So at this point now, I'm going to contaminate this hand. I'm going to take the penis and hold it straight up at more of a 90-degree angle. Or, well, not quite 90 degrees, but basically so that it's straight. I'm going to pull the foreskin back if he's uncircumcised. I'm going to start at the meatus and make one circle around the glands of the penis. Throw that out. I'm going to do the same thing again. Now I'm ready to insert my catheter. Make sure it's really lubed really well. I might bring this closer. All right, sir, take a slow, deep breath for me. And I'm going to go ahead and insert. I just keep inserting. Slow, deep breath, and make sure to assess him while I'm doing that. Do not force. About now, I see urine, but I still continue all the way down to the bifurcation. I don't go just 2 to 3 more inches past urine. I go all the way down to the bifurcation. Slow, deep breath. Once I'm there, I can go ahead and I'm not inserting anymore, so I don't have to be sterile with that hand, so I can go ahead and grip it. If you don't grip it when you're trying to inject the fluid, either for the female or the male, your body wants to kind of push it out a little bit, so I'm holding on to it. Not so tight that I can't put the sterile water into my balloon. And then I inflate the balloon completely, all the way, just like I did for the female, holding on to my syringe so that it doesn't deflate, while I take the syringe off. And then I pull back till I meet resistance. Don't yank, just pull back gently. And I'm going to do the same thing I did for the female, where I take this, put a stat lock on it or a bag, and again, I'm going to watch how much urine comes out while I clean him up. You know, clean everything off, clean him up, throw the materials away in the appropriate place. Put this on the bedside. And if your facility has a policy that you may have to hold it for 20 minutes if it goes past 1,000 mils to prevent bladder spasms. That you don't usually have that much come out right away, but if you did. So that is how you insert for a male. And of course you take it out the same way as what I showed you in the video for the female. And of course clean them all up.